Hey guys, welcome to my channel. Welcome to the Riggy Report. My name is Riggy and today we're going to talk about Walmart Health. So I'm not going to lie, when I first saw that Walmart was going to be offering healthcare services, I was concerned and just a little bit scared. Because when we usually think about Walmart, we typically think of people with their crazy shenanigans, like these guys that were doing like Walmart wrestling on social media, like joking about stealing at Walmart.
Yeah, it's okay, it's okay to steal from Walmart.
That one kid that was yodeling in Walmart last year. All that being said, despite its image problems and branding issues, Walmart is a behemoth of a company, averaging 150 million customers nationwide weekly. And it's one of the only retailers that's been able to withstand the Amazon retail takeover. So despite all of the crap that people give Walmart on social media, a lot of people still shop there. Walmart is still near and dear to the heart of a lot of Americans. It's not a secret that healthcare has been a hot topic in America for a while now. All you have to do is turn on a TV, turn on the news, and you'll hear either the Democrats or the Republicans. Someone is talking about healthcare.
Healthcare as a right.
To repeal and replace Obamacare.
Repeal and replace Obamacare.
Healthcare was a top priority for voters.
This is the single biggest policy initiative that we are dealing with.
Walmart is actually not really offering anything that's like super innovative or anything super crazy. They're just offering 3 services. 1, $30 checkups. 2, $25 teeth cleanings, and the last one is for mental health counseling services for just $1 a minute. Now these might not seem like a lot, but is there a market for it? The answer is a resounding yes. 1 in 4 Americans refuse to have medical care before they can't afford it, and over half of Americans delay or don't get health care because they can't afford it. When you really sit there and you think about how many people go undiagnosed for so long for issues or diseases that they could have caught early, that they could have been prevented, how many people go without preventive care because of their inability to get insurance, then this is going to be an absolute disruptor when it comes to healthcare. Because when you look at how insanely high the cost of healthcare is in America, you realize why some people don't go to the hospital, or they are afraid to see doctors, because medical bills are one of the things that are absolutely plaguing Americans right now. Pretty much everyone you know has medical bills. Hell, I have medical bills. And a lot of people, even when they're insured, when they have insurance, they're underinsured, they can't afford it. For example, I'll give you myself personally. Before I started my job I'm working at now, I was uninsured because I was like a college kid. My mom couldn't afford insurance for me and my sister and herself, because when we tried to get insurance through Obamacare, it was like $800 and we just couldn't afford it. Even now, I have like a job and I have employer-sponsored healthcare. From if something were to happen to me right now and I would try to go to the hospital, my health insurance wouldn't kick in until I pay my $3,000 deductible. And I'm in my early 20s. This is my first time having like really good health insurance, and from what I heard from other people that have asked like advice and stuff, they told me that the healthcare I have is pretty good. However, it doesn't kick in until I pay a $3,000 deductible. When you take into account that over 69% of Americans don't even have $1,000 saved. Even when you have health insurance that is being paid for, you can't even use it without a really high deductible. They have their first health hub in Georgia, and the very curious thing about, I was reading in the article, one person drove 75 minutes from wherever he lived just to go to this health hub in Georgia. So I do think that Walmart is going to be very successful with their health hub, just because it's something that is so needed and they're being a disruptor. And if you already know, like Walmart already has 150 million people walking into their stores, so it's not like they're gonna have a huge advertising budget for it. Yes, they're going to have to work on their branding, because no one is gonna think first thing that comes into their mind. Hey, let's go to Walmart. If something is wrong, you probably think let's go to the emergency room. But when you think of how deeply rooted Walmart is in rural areas, because that's where they started, that's where their brand is built, then they definitely have, you know, the space and the heart and minds of a lot of people just to be able to transition into that space, because American healthcare is so expensive that a lot of these people, Walmart is going to be their only option. Because for Walmart, the thing that's going to be really good for them is because their pricing is very clear, it's very, you know, upfront. And that's one thing that the article mentioned, that the enrollment's pricing is upfront. I can't tell you how many times I've gone to the doctor and then I receive the bill and it's a lot higher, or I'm not sure what the bill is, and that's what keeps a lot of Americans from going to the doctor. But when you go to Walmart, price is always going to be there and everything is going to be very transparent. And as we know, Walmart is really, really good at cutting costs and keeping prices really low. So that would be something that's going to be, you know, hopefully passed down to the customers. That's it for today. Let me know what you guys think about my first video. Don't forget to like, comment, and subscribe, and give me a thumbs up, and I'll see you on the next one.